Sound check's good. So let me know when we start getting some numbers. We got 5 in there. You 5 can hear me okay? Somebody leave me a comment. About 12 minutes till we get started. About 10 minutes. What's that? Welcome, everyone. We're about 9 minutes from getting started. We're about 9 minutes out. Is that going to hurt the sound? Is that air? Let me turn it off real quick. Yeah, go ahead and turn it off. We're about 5 minutes out. Welcome, everyone. How are we looking?
We got 30 in right now.
Welcome, everybody. We are about 3 minutes out, 3 minutes away. We'll get started. 1 minute out. One minute away, guys. Ready to go?
Yeah, we're good.
All right. 20 seconds.
Yep.
And you ready? All right. Welcome to tonight's class. I know that most of you are probably at home in your warm house in your pajamas or some sweats right now watching this. That's one great thing about a webinar. Parker and I needed a dog sled to get here today because I am in my office. Some of the bridges were closed, some of the roads were closed, but we made it. And so the class tonight is going to be about autoimmune disease. And the reason that I named the class A New Paradigm in Immune System Rehabilitation is that for whatever reason, the general public really doesn't think about the immune system as being able to be rehabilitated from autoimmune disease. And, you know, I recently had knee surgery and I'm going through rehabilitation to rehab my knee. And that makes sense to everyone. But for whatever reason, it doesn't make sense to us that we can rehabilitate our immune system. We've just thought autoimmune disease is a life sentence, and that's what we've been told, and that's the way it is. But it's not really the case. Your immune system can be rehabilitated. You know, it would make sense if somebody said, it's cold and flu season, you better take some vitamin C to make your immune system stronger and work better. That makes sense. Well, doesn't it then make sense that the immune system can be rehabilitated and made to work much more normal in a wellness perspective? And that's why we've named it A New Paradigm in Immune System Rehabilitation. So let's get started. Welcome to the program. My name is Dr. Kevin Linderman. I have now been on a 25-year quest. I know that doesn't seem, I don't even feel like I should be 25, but I keep adding up the numbers and they keep coming back the same. I've now been in practice 25 years, and our quest is to solve chronic disease without drugs and surgery. And I've been fortunate enough to be rated in the top 10% of wellness practitioners in the country by DSE Enterprises. And we treat frustrated patients that feel like they've tried everything and are looking for a more common sense solution to their chronic conditions and their chronic disease. Now, the program that I am a part of is called Beyond Functional Medicine. And it was developed by Dr. Rob DiMartino out of Las Vegas, Nevada. And we still travel back to Vegas 6 times a year to study Dr. DiMartino's program. And the reason that it's called Beyond Functional Medicine is what that means is beyond just giving you tons of supplements, changing your diet, and telling you to exercise. That's what most people think of when they think of wellness care. Oh, he's going to give me 50 different vitamins and change my diet. Well, with autoimmune and with most chronic diseases, you can't supplement your way to solving that. That's not what the supplement people want you to think, and that's not what the wellness people want you to think. And they want to give you a vitamin for every symptom. Well, how is that any different than giving you a medication for every symptom? The only difference is medication works way better for symptoms than vitamins does. So it's kind of a failing system. And so when we talk about beyond functional medicine, that's what we mean. We've got to get to solutions at a cellular level, which is what we're going to go through here tonight. So I'm so glad that you're here. Our program is backed up by years of research. In fact, this picture is me pulling up some of my autoimmune research to prepare for the class tonight. So I have drawers full of research to back up everything that I'm going to say here. And you know, you guys are welcome to look at any of that research, but it is the opposite philosophy of most traditional medical treatments. And the big problem that I have to pick with traditional treatments in America is it a lot of it's designed around a diagnosis, right? Isn't that why you go to the doctor to get diagnosed? Well, if you will forever change the word diagnosis to the word label, some of these diagnoses become a little bit silly. For example, let's just say that my sinuses have been painful and inflamed for 2 months. So I go to a specialist, I go in there, wait 2 months, spend $2,000, and he comes in and says, you have sinusitis. Well, if you look itis up in the medical dictionary, it means painful and inflamed. So basically you're saying, doc, my sinuses are painful and inflamed. And he says, you have sinusitis, which means your sinuses are painful and inflamed. And we see that as the big answer, like he figured it out. Labeling your list of symptoms using Latin and calling it a fancy word does not actually get to solutions in many of these cases. So we've got to ask the deeper questions. And especially with autoimmune disease, because in autoimmune diseases are named by the tissue that your immune system is attacking. So if your immune system is attacking your joints, you have rheumatoid arthritis. If it's attacking your thyroid, you have Hashimoto's disease. If it's attacking your gut, you have Crohn's. If it's attacking your connective tissue, you have lupus. But what about the fact that your immune system is attacking your own body? It doesn't really make as much difference where it's attacking as it does the fact that it is attacking, that something has caused your immune system to run rampant and attack your own tissue. So labeling it as the tissue where it's being attacked leaves things to be figured out. It leaves some larger questions. And so that's what we're going to do here tonight, is ask some of those deeper questions. Now, please don't get me wrong here. Our traditional doctors are some of the finest trained individuals in the world. I have a medical doctor. I have medical doctors that refer to me, and I refer to them. So please don't get me wrong. They are some of the finest trained individuals in the world. But Americanized healthcare is absolutely brilliant whenever it comes to acute care and trauma. What acute care means is I have something that's going to kill me very quickly. I need a heart transplant. I'm having a heart attack. I have a bloodborne infection that's going to kill me. Americanized healthcare is absolutely brilliant at that. Like if I'm having a heart attack, bring me to the hospital. And if I get to the hospital in time, I'm probably going to be okay. That's called acute care. And then, my gosh, with trauma, they do absolutely brilliant work with trauma. I can literally cut my arm off, carry the arm into the hospital, and they can sew it back on, and I can use my arm again. That is absolutely brilliant. But Americanized healthcare struggles whenever it comes to chronic disease. Things like diabetes, thyroid, autoimmune, those type of conditions, Americanized healthcare with the medication model doesn't do as well for us. You know, if I said, just post in the comments, name a chronic disease we've cured in America in the last 100 years ago. You're going to have trouble finding something. That's not really the way it works. And so we must begin to turn to a more common sense system of healthcare in America and accept wellness care as part of the picture. Certainly not all of the picture, but there needs to be a seat at this table called prevention, functional medicine, and natural health care. And that's what I'm trying to bring to the table. Now, America consumes 60% of all the pharmaceutical drugs on planet Earth, and we are less than 4% of the world's population. We have more doctors and hospitals than any other country in the world, and we spend more on healthcare than almost the rest of the world combined. Yet China and Cambodia have a longer life expectancy than we do. In fact, we rank about 45th in the world in life expectancy. We're behind the Czech Republic. We're behind Slovenia. We're now behind Cuba. Cuba is a communist third world country with crumbling hospitals, and they outlive you in the United States of America. How do we accept that? And so the problem is we need another seat at the table that's prevention, functional medicine, and wellness care. And that's what we're trying to bring here. So I'm so glad that you're here. Now, by the way, certainly, if you feel like your medication is helping you live a better life, I am 100% for that. Do not get me wrong. I do not want you to change your prescriptions. I talk to patients every day that say this medication is actually giving me my life back, and I am all for that. So please don't misunderstand. I do not mean anything like that. Now, what autoimmune disease actually means at its core is that your body is attacking itself, that your immune system, normally designed to fight off colds and flus, has instead started attacking your own cells, attacking your own tissue. And what autoimmune disease means, so listen, don't get this wrong, because some patients see autoimmune as not that big a deal. Oh yeah, doc, I have autoimmune. Doc said there's nothing I could do about it. It's not a big deal. It is a big deal. What autoimmune disease means at its core is that your immune system has lost one of the basic functions of life, which is called self-regulation. So what I mean by that is this. If we were to discover something on Mars that we wanted to know if it was life or not, like let's say we find something, in one of the ways we determine that something is alive is, can it self-regulate? Meaning, can it control its internal temperature? Can it control reproduction? Can it control its immune system? If you have autoimmune, your body has lost its ability to self-regulate. And that is not a good thing for the future. That's not a good outlook. So we need to dive into this. Now, this conversation, if we're going to get into the why and how all this happened, I want you to know it's complicated and difficult. We're about to get deep into some science and cellular biology. And I just need you guys to hang in there, and you're welcome to post your comments. And if you have any questions, Parker will ask me the question and I can answer it. So make sure that, don't get too confused, but we're going to get deep into some science. And if y'all need to stop me and ask, just comment and we can do that. Now, the first thing that I wanted to lead with here tonight is what Dr. Rob has called the #1 biggest secret to achieving good health. If I had a magic wand and I could wave it over the earth and solve one health problem to do the most good, it would be this. And it's what Dr. DiMartino has termed energetic debt. So what energetic debt means is this. The energy molecule of your body is called ATP. ATP is to your body what gasoline is to your car. It's what fuels you. Every time you accelerate from a stoplight, it's fuel that does that. And that's what ATP is to our body. It's like dollars to your bank account. In your bank account, you have to deposit more dollars than you spend out. And we've all had the other way happen, where we're spending out more than we have in there. And that's called deficit spending, or you're spending in debt. And in your body, you have to make more energy than you spend. And as long as you do that, you can be healthy. But the problem is, if you start burning more ATP than your body is able to make, you are in something called energetic debt. And what ends up happening is your body will look up one day and say, we're in crisis mode. And you cannot be in crisis mode and healing mode at the same time. I talk to patients every day that have been stuck in energetic debt, sometimes for years. So ask yourself, do you ever feel like you're running out of energy? Do you ever feel like you wish you had more energy than what you do? And has that since connected to more and more chronic diseases? Because that's the way the body works. If you have plenty of energy, diseases have a really hard time setting in. But when your energy flips and you're in energetic debt, your body cannot go into healing mode because it's stuck in this barely limping by crisis mode. So imagine it like paying your bills. If it's time to pay your bills and things are tight, what are you going to do? You're going to prioritize, right? So you're going to pay the rent so you have a place to live, and you're going to probably pay the electric bill because we need heaters and air conditioners in Louisiana. But the cable bill, the cable bill can wait. If they cut my cable off, I'm still okay this month. Or Starbucks. Starbucks has to wait because money's tight. Guys, this is exactly what your body will do in an energetic debt situation. It will do this. Heart and lungs, give that some energy. Digestion, we can go a long time without digestion. Skip digestion. Enzymes we don't need. Hormones, having a baby, we can't afford that. We're barely making our energy situation work the way it is. Hormones are going to have to wait. Having a baby, not priority. Libido, are you kidding? We're barely paying heart and lungs, and you want me to pay for libido? That's not happening. And so patients limp through life like this sometimes for years. So let me ask you, when is the last time you felt like your energy was correct and in check? And how has that led to you feeling more and more low energy and more chronic disease? It's probably connected for most of you out there. Now, why is this happening? Because we are in the worst energetic times in the history of the human existence. We have more toxins, heavy metals, and environmental pollutants draining our energy than ever before. And we also have more stress and fast-paced lifestyle than ever before. And we have these crazy infections inside of us like MRSA, staph, and streps, these other things than we've ever had. And at the same time, we have the worst food with no nutritional value that we've ever had, with all these GMO foods and food allergies. And we have the worst digestive health with this leaky gut and this poor gut health than we've ever had. And we have more medication, cross-contaminations, and side effects than we've ever had. Ladies and gentlemen, we have all of this happening at the same time. Your body is energetically overwhelmed. Think of it like this. Think of it like your budget is barely getting by, like you're living paycheck to paycheck, and you check your mailbox and there's a 2-inch stack of bills in there you weren't expecting. So you go back the next day and there's 2 more inches of bills, and the next day, same thing, and the next day, same thing. Your monthly budget would be in trouble really quickly. This is what your body is dealing with, and this is what leads to the confusion that turns into autoimmune disease, which you will see in just a second. Now, no matter what you have going on, no matter what disease you've been diagnosed with, if you're in an energetic debt situation, you will not have an easy time getting out of that disease process. Because if you're at this level of health, I don't care what you call this. This can be whatever level of health you're at now, and you're trying to move up to here, it takes extra energy to move up. Just like in your car to go from 20 to 40, it takes more gasoline. So if you're barely treading water energetically here, you will never get to here if you're not in a good situation energetically. And this is an epidemic in America with chronic disease. Energetic debt is one of those things we see at some degree in almost every chronic disease case that we see here. Now, here's why this is important with autoimmune, and it has to do with your body's ability to make new cells. Most people don't realize the number one energy expenditure in your body is your body's ability to replace its old cells with new cells. You have a new skin every 15 days. You have a new liver about every 8 weeks. You have new cells in your eyes about every 3 days. You have a new heart about every 7 to 9 years. So your body has to continually replace old cells with fresh new cells, or you're not going to be above ground very long. And so one of the main energy expenditures in your body is to make new cells. And the problem is, in energetic debt, your body will make those cells really ugly. Those cells will be deformed and twisted and made poorly Because your body doesn't have the energy to make healthy looking, new, vibrant, bright, beautiful cells. Think of it like building a house. Okay, you could have a pile of beautiful bricks there and a pile of wood, but without the labor to build a house out of that, you're not going to have a very pretty house. You could maybe grab a few boards and put a little plywood shack together, but that's not going to be the beautiful house that you expected. And your cells under energetic debt are that plywood shack. Your cells are deformed and twisted and unhealthy. And in energetic debt, your immune system will look over in autoimmune at those twisted plywood, ugly shack cells and say, I don't know what those cells are over there, but they're not us. That's not what's supposed to be there. We better go clean that up. And so in the medical community, autoimmune disease is seen as the immune system is making a mistake and it's attacking the body for no reason, and there's nothing you can do about it. But in Dr. DiMartino's program, in functional and beyond functional medicine, we look at it a little bit different. It's that the cell replication from energetic debt has gotten so ugly that the immune system looks at those cells and decides it needs to clean those up. And if that's your thyroid, you have Hashimoto's. If it's your joints, you have rheumatoid. If it's your connective tissue, you have lupus. But make no mistake, the common denominator with all of those is the cell replication is really ugly because you have been in a state of energetic debt for way too long. That's the bottom line of what we do here. That's the big deal. That's where all of these cysts and fibroids and growths and nodules are coming from. Is it any accident that most patients with Hashimoto's, which is an autoimmune to the thyroid, also end up with thyroid nodules? Well, those nodules are those ugly cells replicating out of control. It's almost seen as normal in gynecology these days that women are going to end up with fibroids and cysts in their female organs. Is that any accident that those are non-essential organs in your body's priority and we end up with growth there? So guys, there's a reason your body does what it's doing. So let's discuss some of the things that are draining your energy, that are draining your body's ability to heal and repair. And this is a big one, right? Stressed out. So many people are stressed out. And so I've decided that there's really two types of Americans. Those that admit to themselves that they're stressed out, and those that are misleading themselves that they're not stressed out. And so when your body goes into fight or flight, which if you back us up to the hunter-gatherer days, stress was a very short-term fight or flight situation, meaning a predator's chasing us, I'm going to either fight for my life or run for my life. And that's a reflex. This is not something that you can consciously control. The problem is now we don't have a predator chasing us. We have all day, everyday stress. But when I go into fight or flight response, there's over 50 different mechanisms that my body will go through to protect my life. But I'm just going to give you the top 4. The first one is my blood pressure goes up. I need a lot of blood pressure because I'm going to fight for my life or run for my life. So we've got millions of people with high blood pressure and nobody's just ever stopped to go, hey, can you tell me why this is happening? This is one of the reasons why this is happening. The second thing that happens is under fight or flight, my body's going to divert the blood flow from my non-essential organs, which means my digestive system and my reproductive system. And it's going to move that blood into my arms and legs. So digestion shuts off, reproduction and hormones shut off because I'm going to fight or run. I don't need to have babies and I don't need to digest my lunch. And so my arms allow me to fight faster and my legs allow me to run faster. The third thing that happens is my sleep hormones. You're not going to be running from this escaped lion from the zoo and then get sleepy 5 minutes later. Doesn't work that way. The fourth thing that happens is my blood sugar and inflammatory hormones like cortisol spike. Why? Because I need a lot of quick energy because I'm going to fight or run. So my blood sugar needs to go really high. So I have a lot of energy during this situation. Well, guess what? We don't have a predator chasing us. We don't have a lion escape from the zoo. We don't have somebody trying to come attack us very often. We have long-term, everyday stress. And the problem with that is it keeps us in this fight or flight loop. Sometimes from the time we wake up to the time we go to bed, our body is in this stress response. And guess what? You cannot be in stress response and healing response at the same time. And so this is critically important. Stress burns through your energy, causing you to be further in energetic debt. So how do we test this? We have a test called HRV to where we can now hook you up to a computer and it will measure how far your body is in this fight or flight response. And then we can work on changing it. Because listen, I can't change life stresses. I can't make the traffic better, the bills go away, or the boss any nicer. But what I can do is change the way your nervous system adapts and deals with this fight or flight situation so that you're more balanced. And that's all your body needs. The second most important thing is environmental chemicals. Now, guys, listen, we're talking about things that are draining your energy, creating autoimmune. One of those was stress. The second one is environmental chemicals. There's 188 million pounds of chemicals dumped in our water every year. 1.4 billion with a B pounds of chemicals dumped in our air, and 2.8 billion pounds of chemicals dumped on our ground every single year. And let me show you a few of those. The first one is phthalates, which are in plastics. So guys, listen, before I move on, let's all do an experiment together. So over the next 2 weeks, everyone listening is not going to eat anything that has ever touched plastic. What would you eat? There's not much, right? We would probably all starve. And so plastic chemicals, and I know you guys have heard of this before, but you haven't understand the depth of why this is important. These plastic chemicals called phthalates are proven to cause thyroid and hormone disruptions, obesity, autoimmune disease, depression, anxiety, ADD, and brain fog. Now, the second one here on the list is BPA, which is bisphenol A. These are also in plastics, but these are proven. So BPA is what's called a xenoestrogen, which means it mimics estrogen in the human body. Proven to cause thyroid and hormone disruptions, breast and prostate cancer, early onset of puberty. So remember, this is an estrogen. There is so much BPA in our teenage girls' bodies that the average age of puberty has gone from 13 when I was a kid, now down to about 9. You guys have seen these girls. You're like, she is how old? I have a 7-year-old under my care right now that's going into precocious puberty. We've about got it stopped and she's going to be fine. But there's so much BPA in these little girls' bodies that it's changing the rate they go into puberty. So I have a question for you. The boys are getting it too. So what do you think it's doing to them? Yikes. Scary stuff. Also causes obesity, ADD, depression, anxiety. And then the next one on the list is your flame retardants. These are also in furnitures, upholsteries, mattresses, carpeting, electronics, proven to cause thyroid and hormone disruptions, learning problems, autoimmune, ADD, Alzheimer's, so on. And then you have perfluorinated chemicals, which are your stain resistors. An example of a perfluorinated chemical is that Teflon pan that's in your kitchen cabinet right now that's all chipped up and you're still using it. Throw that thing away. That is a perfluorinated chemical and it creates autoimmune disease, thyroid disruption, hormone disruptions, and cancers. Teflon was a terrible idea from the 1980s. The only worse idea was margarine. Margarine's killed more people than cigarettes. That's a whole separate workshop, but just so that you know. Teflon is a really toxic chemical that throws off our immune system. Proven to cause thyroid problems, cancers, depressions, anxieties. You guys get the point. But guess what? This is what you don't realize. The average American eats 14 pounds of those chemicals per year. So to give you a visual on that, that's about like 2 gallons of Drano, drain cleaner. So let's just say we have a beautiful little family sitting here. You know, we have a 3-year-old, we have a 9-year-old, we have mom and dad, and they're all eating breakfast. And I come knock on the door with a pallet of Drano. Look, here's 2 for your 3-year-old. Here's 2 for your 7-year-old. I need y'all to feed them this year. It's just a few teaspoons a day. Next year, I'm going to bring you 2 more, and the next year, 2 more, and the next year, 2 more. No one would do that to their family. Well, guess what? It's already happening just by the regular food that your family eats every single week, every single day. That's how much of this stuff is in there. So the solution is we've got to do some cleansing and some detoxification to pull these hormone and thyroid and autoimmune creating chemicals out of the body so we can refresh the system. That's why we do so much cleansing and detoxification, is for this exact reason. Now, the liver is going to send these toxins to one of 2 places. It's either going to send it to your skin, or it's going to send it to your fat cells. So your body will build more fat cells for no other reason than how toxic your liver is. So the way we're able to do the miraculous results with skin problems is through this cleansing and detoxification. And so the solution is to pull all of these toxic chemicals out of the body. And I don't know how good you guys can see this, but this patient had cystic acne for years. And the picture on the right is her after 3 months of just working on detoxifying her liver. This is Camille. If you look at Camille's pictures on the left, she had cystitis in her face for 6 years. It was autoimmune cystitis, and she had been on cortisone for 5.5 years. And I'm talking the strongest cortisone you can possibly be on. She had stopped going to dinner with her spouse. She had stopped going to family functions. This is Camille's picture on the right after 3 months. Now, if you'll notice this, if you guys can see this, she still had a little bit of reddening. And I wanted to show you Camille's picture upon her release. This is Camille's after. How did we do that? Through detoxifying all of these toxic chemicals out of her body and solving her energetic debt. She's now off all her cortisone. Now, Camille's quite a character. She actually said the other day, she said, you know, now that I'm going in public again, I actually have to deal with people. She has to deal with people in the public. And so, yes, Camille, you now have to deal with people. But we're so happy that she got such amazing results here. Now, you can also get dramatic weight loss because as you detoxify the liver, those fat cells that were being built to store these toxins in will be burned. And so I wanted to show y'all some befores and afters. And I'm sorry to do this to you guys, but Peter does have a Speedo on in these pictures. You ladies just try to remain calm and don't leave me any ugly comments. I had to share this picture with you guys, but he lost 7 inches and 31 pounds in his waist by doing nothing but getting rid of all of these poisons that are in the body. David's shirt fits way better in that second picture. I hope you guys can see this, but he lost 75 pounds, got off his blood pressure, cholesterol, and diabetes medicine, and we solved his sleep apnea. Now, this patient was actually 240 pounds with sleep apnea, high blood pressure, shortness of breath, and was pre-diabetic. And ladies and gentlemen, that used to be me. And I lost 73 pounds by detoxifying all the junk out of my body. Now, there are some other things that are costing you energy and creating autoimmune disease in your body. And the first one listed here is leaky gut syndrome. So let me go to the board and I want to draw, because I know you guys have heard of leaky gut syndrome, but I wanted to show y'all what this actually means, because I can tell you this, to some degree, whether it be a lot or a little, everyone listening to this webinar right now has leaky gut syndrome, and this creates an autoimmune reaction in the body. And here's why. So if you look at your digestive tract and you take a bite of food, let's say you take a bite of lettuce. That lettuce is supposed to stay in your digestive tract and be broken down to what? Carbohydrates. And then a little pore opens up and this carbohydrate gets in your body, into your bloodstream to make what? Energy. That's what we want to happen. When you eat food, that food should be digested in your digestive system and not cross into your bloodstream until it's nutrition, carbohydrates, fats, and proteins. What leaky gut means is this. You have a tear here, and this piece of lettuce gets into your bloodstream early, not as carbohydrates, but as chunks of food, as chunks of lettuce. Well, there's nothing to turn that into energy. Your immune system has to now activate and go dispose of this lettuce as if it were a foreign object. Think of it this way. Imagine if I brought you in and I hooked an IV in your arm and I fed you carbohydrates in your bloodstream. That would help you. They do that at the hospital every single day. They put people on an IV and they feed them nutritionally through an IV. But what if I injected chicken particles and lettuce particles in that IV? Would you be okay? You would go septic very quickly. That cannot happen. That's what happens with this leaky gut syndrome. Now, why can I confidently tell you that everyone listening has this? Because the herbicide Roundup rips holes right through our gut lining, and Roundup is now in 95% of our food. It's in almost 100% of the water that we drink. Traces of Roundup are literally in everything. Even the organic foods that I eat have traces of Roundup in them now. And so we treat this on 100% of the patients that come in. Everybody gets the treatment. It's just something that we do. I've treated myself. I've treated my family. I've treated the staff. Everyone gets this because everyone has this to some degree. So that's called leaky gut syndrome. Now, the next thing on the list there was stealth infections. So let me show you what that is. What a stealth infection means is that you have a foreign invader in your body that you don't know that you have. Bacteria, viruses, parasites, protozoas, amoebas. You have some kind of foreign critter living in your body that you don't know that you have. It's a stealth infection. You don't have a fever, and so you don't really know that you have these. The number one place we find stealth infections is in the teeth, in the dental work. Don't sleep on the fact that your bad teeth may be causing you to stay stuck in an autoimmune response. And here's why. If you look at a tooth, I'm not an artist, but if you look at a tooth and I come in and I do a root canal and I drill down in this root and I cap this tooth, well, I'm going to kill tissue in here, and that tissue is going to rot. And that's going to drip infection out in my body, sometimes for years. Patients come in and go, oh yeah, I've got a bad tooth. It's been kind of bothering me for about a year. I haven't done anything about it. Or I had a root canal 2 years ago, and yeah, I've been autoimmune ever since then. I don't know why. Don't sleep on the fact that you may have a stealth infection somewhere in your body. The second most common place is in the sinuses. There's a nasty bacteria that lives in your sinuses called Marcons. Sorry about the writing, guys. I am a physician. The handwriting just doesn't get any better. But what Marcons is a hidden infection that's antibiotic resistant that lives in the sinuses. And this is a nasty bacteria. And what it does is it goes dormant. You hit it with antibiotics, it goes dormant. And then pretty soon, boom, it comes back out. And the patient goes, I got another sinus infection this week. It's the same one. It's living in your nose, and it's called Marcons. And this can create an autoimmune reaction. So these are called stealth infections. We go back to the slides. The next one that I have listed under there is food intolerances. So your body, if you're autoimmune, your body may be looking at a certain food as something that needs to be attacked. Think of it less than a food allergy, because this is not the skin allergy that they do at the allergy clinics. This is a different thing. This is a less of a response, but it creates a different type of an immune system reaction. I had a patient not too long ago one of my fibromyalgia patients, she kept having, and she had done our program already. She was doing great. She had no problems. And then all of a sudden, a couple of times a month, she would have these really crazy flare-ups. And we never could figure out why. So I did a food intolerance test on her, which I have a lab where I can test you for 200 different food items. It was broccoli. Who would have ever thought to her body, broccoli was something that would create a flare-up and create a reaction? The only way to know this is just to test you. Now, the big five, of course, are corn, soy, wheat, dairy, and gluten. And before we had this testing, we would just say, eliminate those 5 things and you should be fine. Not in today's world, not with all these GMO foods, with all this asparagus and broccoli and all these crazy GMO alternate foods that we have now. It could be anything. So don't sleep on the fact that you may have some unrecognized food intolerance, but it's really hard to just guess this because it can take 4 days for this reaction to happen. And so you might feel like crap on Thursday and you ate broccoli on Monday. How are you ever going to connect the dots there? It's impossible. So we have to test this out. And then we have EMF toxicity, which is all of the bombardment of the Wi-Fi's and 5Gs, this laptop, these lights, that laptop, my phone. All of these things create electromagnetic fields. And if you have heavy metals inside of you, like silver fillings, or you have some type of heavy metal in your body, can you put metal in your microwave in your kitchen and everything be okay? No. So if you have heavy metals, you're metal in a microwave, and that's not going to be good for you. So I told you guys this was going to get complicated, and we have to figure out all of the details of this, because here's the thing. It's probably not going to be one problem. It's going to be multiple problems, all causing your body to one day turn autoimmune. And if we're going to turn it back off, we can't leave any stone unturned at figuring out all of these different possibilities. And that's what we do here. All right, is everybody still with me? So what we've learned so far is energetic debt is the cause of chronic disease, that your body must take in more energy than it uses up. And we discussed the things that are costing your energy, and we must find and correct every cause creating this irritability, this immune system aggravation in your body. What's making your immune system so confused that your body can't even self-regulate? That's how important this is. So we must fix the energy system of the body. We must eliminate leaky gut and other digestive imbalances, solve stealth infections, stop cellular mutations. We have to eliminate chemicals in each body system. We have to eliminate the food intolerances, reduce EMF toxicities, stop the fight or flight system of the body from going into overdrive, and reduce the overuse of medication cross-contaminations. And we have to do all of these things at the same time, or your body will continue to get madder and madder and madder. 50% of the time, if you have one autoimmune disease, you will develop another one that you don't know about. Why? Because it's not your thyroid's fault your thyroid is being attacked. It's not your joints' fault your joints are being attacked. That's not how this works. There is a specific reason or set of reasons that's creating this reaction in your body, and we have to dig deep and ask all of these questions that have not yet been asked if we're going to get any real answers about why this is happening in the human body. Then we must rebuild each system in the body so that we can stop this cycle of confusion, allowing the body to stop attacking itself. And so that's why I always laugh on these videos when you get these comments of someone going, just go carnivore, it'll fix it. Or just go vegan. Those are complete opposites. Or just eat fermented food, or eliminate gluten, or just solve the gut and all autoimmune disease will be solved. Yeah, until it's not. And then what do? Each one of those things are very tiny correct. They have a little bit of correct answer in all of those things, but you have to do them as one system. So stop listening to unqualified people. Everybody listens to their aunt or their cousin that did one thing and things changed for them. That doesn't mean it's going to change for you. You have to look at all of these solutions as one package. So how do we fix these things? Our care begins with this very important question. Why are the cells doing what they're doing? Why is this reaction happening? And how do we get the body to do something better? Why are the cells so confused? Why is the immune system doing this? Because here's the thing. In functional wellness, in our program, we really don't think the body is stupid and it's making mistakes. Oh, your body's stupid. It doesn't know what it's doing. It's doing this. No, that your body's doing the best it can with the really crappy hand that it's been dealt in today's society. That's the truth of this. And we got to deal it a better hand. So guys, in closing, humans are exposed to more harmful toxins than ever before in the history of humans. Our fight or flight hormones are raging 24/7. We're bombarded by harmful EMFs. We're stimulated by harmful blue light from our phones. We don't get the sunlight that we need. We're loaded up with resistant infections. Our oxygen is depleted. Our water's dead bulk water with fluoride in it. We're in the worst energetic shape in the history of the human existence perspective in America. And I look to be that for you. So we offer unique solutions to everything that we've discussed here. Each case is a little bit different. Each one of you may have a little bit different combination of these things. So our program is not cookie cutter. We don't do the same thing for every lupus patient like the traditional field does. Every lupus patient gets the same prescription. That's not really how this works when we start diving into why these conditions are happening. So the only way to determine your individual pathway to achieving great health is just to evaluate you one-on-one. I've got to sit down and look at all of this for you if we're going to figure this out. So I would like to close by offering each one of you a very special chance to be screened for all of these possibilities. And then after your screening, I can sit down with you, tell you what I found, and we can talk about it. So if you're truly ready to begin this journey of complete health and wellness, if you're willing to go through the necessary steps, if what I said tonight here makes perfect sense, all you have to do is click the link pinned in the comments and it will connect you to my new patient team, my amazing new patient team. They'll ask you some qualifying questions to see if you're a good fit. And if you are, they will schedule your appointment with me. So imagine yourselves a life of great health and vitality. Will you choose it? I would like those of you that are sick and tired of being sick and tired to click the link in the comments, but only if you're really ready to follow a program to solve your chronic disease, because this is not easy. This is something that's a team effort, and we have to dive into all of these questions together. But I'm here and I'm ready to take it on. So click the link. Thank you guys